Hello, everybody. This is Edward Shin, and welcome to our webinar. I'm the CEO, co-founder of Quality Reviews, and we are a digital patient engagement solutions company based in New York City. And it is my pleasure to introduce and welcome our guest speaker today, Dr. Alan Copperman. Dr. Copperman is the Managing Director and CEO of RMA of New York and Division Director of Reproductive Endocrinology and Infertility, and clinical professor of obstetrics, gynecology, and reproductive science at the Icahn School of Medicine in New York as part of Mount Sinai. So welcome, Alan.
Thank you, Ed. Really a privilege to be here.
Thanks so much. So as the title of the webinar suggests, we're just looking at an overview, both prospective and retrospective on the IVF in general. And I just want the first question is, what are you seeing that's really exciting in terms of advances and emerging trends in patient care as it relates to reproductive medicine?
We're seeing higher success rates. We're seeing prevention of disease with genetic testing and identifying at-risk couples. We're seeing communities that have been underserved in the past, the LGBTQ community, communities of color, suddenly being able to access care at a exciting pace, one that hasn't been necessarily the focus of our field in the past. And I think overall we're seeing better outcomes. And I owe a lot of this to better data, employer-sponsored benefits, and the media just promoting awareness of fertility as a disease.
Got it. Just full disclosure, as you know, we went through the IVF journey with you and had great success. And that was a while ago. And as you mentioned, it seems that the media are picking up on this emerging trend of fertility and generating awareness of it. You mentioned a couple of things that I wanted to drill down into. One is traditionally underserved populations. Talk to me about what you and your team and some of your colleagues out there are doing about trying to increase access to fertility treatments to traditionally underserved populations.
I think we're participating in more and more insurance companies so that patients don't have to bear this burden out of pocket. We're advocating for coverage for fertility preservation, which has been thought to be elective in the past, and now we realize this is essential health maintenance. And we have taken gender out of our consent forms and out of our portals. We ask pronouns of patients so that the LGBTQIA+ community is going to feel welcome and heard and seen. I think that we're becoming a little bit more aware that this is not our delivering care, but our partnering with patients to give them the care that they need and they want.
Excellent. You mentioned a couple of times now kind of insurance and healthcare payers expanding access to fertility treatments. Can you just provide, to the extent that you can, some examples of where you see insurance companies expanding that access and covering more of these services?
Sure. I mean, Mount Sinai, my parent institution, just started to cover fertility preservation for its trainees, and female physicians have long struggled with infertility because they spent a decade training, and often by the time they're ready to build their families, they're having struggles finding a healthy egg and fertilizing it and implanting. And now access to fertility preservation is a game changer.
And are you seeing that across the board? And certainly Mount Sinai as an employer, but in terms of the insurance plans that you accept, especially the employer-sponsored ones, is that emerging trend in the greater kind of business world?
I think so, and it's not only just the tech companies or just the law firms. GHI is covering the teachers and the policemen and the fire department and the court workers, and we're seeing access to care and just awareness of benefits, employee health days. We're just informing people that there are options out there. Most patients who are infertile don't even know that they're infertile, don't go for an appointment, don't access all the coverage and care that they're even entitled to under